Hello, Sonoma County. Today I'll be talking with Dr. Sundari Mase, our county's public health officer. The public health officer is responsible for the protection and promotion of public health for all of us in Sonoma County. Dr. Mase, how is our county responding to the current public health orders?
Well, Supervisor Gorin, I am so impressed with our public. Our community has stepped up and is abiding by the shelter-in-place order largely, and it's had a great impact in flattening the curve, and I thank everybody.
And thank you so much for being by our side and giving us the encouragement and direction that we need.
You're welcome.
So I think that we've been having discussions about the road to recovery or reopening, and it really depends on increased testing. So when do we expect our local COVID surge, certainly, and then when can we expect more testing?
Well, you know, our modeling still shows that we're a little ways away from a surge, and partly it's because we've had the shelter in place that's been so effective. But as far as testing is concerned, I'm really happy to say that we're getting increased capability for testing. In fact, we've been able to get a lot of the swabs and test kits necessary, and we're starting. So we have a priority scheme. We're going to start this weekend testing our healthcare workers as they are in the front line taking care of everybody, including those with COVID. So we're going to start with symptomatic healthcare workers and then asymptomatic healthcare workers. Then we'll move on to our symptomatic first responders, that is law enforcement, our firefighters. And then we'll go on to symptomatic people over age 65 because they're very vulnerable if they get COVID for really bad outcomes. Then we're going to go to our first line, that is our symptomatic service providers. So in other words, utility workers, service workers, the courts. And then we're going to get to the public, the community. Anybody who has symptoms will be testing.
There's been a lot of conversation regarding our testing, the antibody testing, and could you explain a little bit about what we might see in the month ahead and maybe talk about our drive-through testing that we are currently setting up?
Right, so you'll have more information about the drive-through testing with very specific ways in which to get an appointment. But as I said, we are prioritizing people. And in public health, our disease control nurses will be testing people starting this Saturday and every day thereafter. So we'll be putting out a number that can be called by that specific group of people that we're prioritizing. And we'll let you know exactly who that is. And this Saturday, it'll start with symptomatic healthcare workers. People can call, get an appointment, and drive through and get tested by our nurses. And we're planning to do about 200 tests a day starting Saturday. Now, what I see in the next month is that this testing will definitely, as we go through our priority groups, be available for the community, for anybody who's symptomatic. Come on in and make an appointment, of course, by calling and drive through and get tested. And I also see us getting the antibody test by next month.
This is excellent news and will be so comforting to our community because they've really wanted to see more testing in the community. But how are our hospitals doing and our healthcare partners? Do we have enough beds in our hospitals and ICU beds?
Yeah, we definitely have the surge capacities, especially because shelter in place has been so effective. Now, let me just remind people that one of the key reasons for shelter in place was to make sure that our hospitals were prepared and that we didn't have an overwhelming surge that would sort of incapacitate our healthcare workforce. So we've achieved that goal. I'm very happy to say that with the flattening of the curve, we are ready. We already have surge capacity of beds. Each hospital has its plan. We have our alternate care sites all set up, and they'll be ready to get started. And I think we're ready.
Excellent. I know swabs were a limiting factor. We've seemed to have found the supply for swabs. Thank you for that. How about ventilators?
Yeah, that is still an issue that we're working on. And we need to put in place enough ventilators for the surge capacity. So that would be one place we're still working on, but rest assured, by the time we have our surge, we should be all set with ventilators and ICU beds as well. That's another area that we're busily working on behind the scenes.
We want to make sure that we have all of that capacity, and thank you so much to you and your staff for really working on identifying that capacity. The current shelter-in-place order expires May 3rd. What's going to happen after that? What will our next shelter-in-place order look like?
Well, I want to remind people that there is the executive order from the governor at the state level that pretty much covers most of the things that, almost everything that our shelter-in-place order is also covering. So that order has no end date. So everybody will be abiding by that. We are planning to align with that order, and we will have our own county order since there's some specific areas that we're addressing to make sure that our community needs are addressed. So you'll be hearing from us by next week as to what's happening in terms of that order.
So what can our residents expect over the next 3 months? What are your notes of caution or optimism?
Yeah, I feel that I'm really happy, first of all, that everybody is abiding by the orders, and I'd encourage everybody to continue doing that. You are making a difference by sheltering in place and only leaving your home for the essential business and activities. We do have the health officer order for the facial coverings for the general public and masks for healthcare workers and other staff at our patient care facilities, masks or facial coverings for the congregate settings that are not patient care, board and care homes, the residential care facilities, the jails, things like that. So please, everybody, do abide by the orders. And I think over the next 3 months, we're going to try to slowly relax the restrictions of shelter in place while we ramp up the testing ability. We're going to find all the people who have COVID, ensure that they're isolated outside of the community, out of the community, and that their contacts are traced and also tested. So I feel like over the 3 months, we're going to see progress. I'm very optimistic.
So we seem to have groupings of 3 in every communication messaging that we have. What are your 3 messages that you wish to convey to our community?
First and foremost, please do, as I've already said, abide by all the orders because they're making a difference. You are making a difference in flattening the curve, which means we have less hospitalizations and we're saving lives. That's one message. The second is we are moving towards a soft closure of the parks, meaning that we're going to be opening the parks up for people to enjoy by next week. And I want people to really be abide by the orders that we put out as to how we want people to access the parks. And if you see that there are large groups of people at parks, then I think it's better to stay at home and go when it's your turn and when the parks are not crowded. And lastly, keep in mind, as my third message, that shelter in place has been incredibly effective in decreasing the numbers of cases, hospitalizations, and deaths. So please do help us moving forward with all of our guidance.
I really want to thank you and all of your great staff for the help that you have given to our community and working through the COVID-19 pandemic. Thank you for taking the time to answer these questions. And I think the best news of all will be your communication about a soft reopening of our parks. It's what everybody has been chomping at the bit to see. So I appreciate the due deliberations that you have given to that. You've listened to the community, heard the community, and know how important it is for us to be out recreating and exercising. So thank you so much. This interview is part of my virtual report on COVID-19. Look for my virtual reports online at socoemergency.org or on youtube.com/official Sonoma County. Stay strong, Sonoma County. Stay home and save lives.